If you have sciatica pain and you are over 50, I need you to stop what you are doing and watch this video carefully, because right now there is a very good chance that something you are doing every single day, something that feels completely harmless or even helpful, is actually making your sciatica significantly worse. I see this in my practice constantly. Patients who have been dealing with sciatica for months or even years, they have tried everything. They have rested, they have stretched, they have taken medication, and nothing seems to work. The pain keeps coming back, sometimes it gets worse, and when I sit down with them and go through their daily habits, I find the same mistakes over and over again, things they were never told not to do, things that seem logical but are actually working directly against the healing of their sciatic nerve. Today I'm going to show you the 5 most common mistakes people with sciatica make after 50. And for each one, I am going to show you exactly what to do instead. But before we get into the mistakes, I want to quickly cover the 3 most common causes of sciatica after 50. Because understanding why your sciatica is happening is the foundation for understanding why these mistakes make it worse. Stay with me through the entire video because mistake number 4 is the one I see most often, and it is the one that surprises people the most. Let's get into it. Now, in video 3, we covered what sciatica is and how the sciatic nerve works. So today I want to go a level deeper and focus specifically on the 3 causes that I see most frequently in my patients over 50, because the mistakes and solutions in this video apply differently depending on which cause is driving your sciatica. Cause 1. Disc herniation. The first and most common cause of sciatica in people over 50 is a herniated disc. As we covered in video 3, your spinal discs are like jelly donuts, a tough outer ring with a soft fluid-filled center. After decades of use, the outer ring can weaken and develop small tears. When that happens, the soft inner material can push outward through those tears and press against one of the nerve roots that form the sciatic nerve. Now, here is something very important that most people do not realize about disc herniations. They are not always caused by one dramatic injury. In fact, the majority of disc herniations I see in patients over 50 developed gradually over years of repeated small stresses, consistently poor posture, years of bending and lifting incorrectly, prolonged sitting with a rounded lower back. The damage builds up slowly until one day the disc reaches a tipping point and the herniation occurs. The good news about disc-related sciatica is that the majority of herniations improve significantly without surgery. Studies consistently show that in most cases the disc material that has herniated actually reabsorbs over time as the body breaks it down. But this healing process requires that you stop doing the things that are re-stressing the disc every day, which is exactly what we are going to cover in this video. Cause 2. Spinal stenosis. The second most common cause of sciatica after 50 is spinal stenosis. Your spine has channels and openings through which nerves travel. The spinal canal runs down the center of your vertebrae and contains your spinal cord. Smaller openings called foramina on the sides of each vertebra allow individual nerve roots to exit the spine. Spinal stenosis means that these spaces have become narrowed, and after 50 this narrowing happens as a result of the cumulative changes that have been building for decades. Disc height loss means less space between vertebrae. Facet joint arthritis means bone spurs can develop and encroach on the nerve channels. Ligaments that support the spine can thicken over time and further reduce the available space for nerves. The result is that nerves that once had plenty of room are now being compressed in a space that has become too small for them. Stenosis-related sciatica has a very characteristic pattern that distinguishes it from disc-related sciatica. People with stenosis typically find that their symptoms are worse when standing and walking and better when sitting or leaning forward. This is because leaning forward slightly opens the spinal canal and gives the compressed nerves a little more room. Standing and extending the spine does the opposite. It further narrows the canal. Understanding this pattern is critically important because it determines which positions and activities help versus hurt. And it means that some of the advice that helps disc-related sciatica can actually make stenosis-related sciatica worse. Keep this in mind as we go through the mistakes. Cause 3. Piriformis syndrome. The third common cause of sciatica after 50 is piriformis syndrome, and this is one that is frequently missed or misdiagnosed. The piriformis is a small but powerful muscle located deep in your buttock. Its job is to rotate your hip outward. The sciatic nerve runs either directly through this muscle or immediately next to it. The anatomy varies slightly from person to person, When the piriformis becomes chronically tight or inflamed, it compresses the sciatic nerve and produces symptoms that are virtually identical to disc-related sciatica. Pain in the buttock, shooting pain down the leg, numbness and tingling, the whole picture. The key difference is that piriformis syndrome does not involve the spine at all. There is no disc herniation, there is no stenosis. The problem is entirely within the muscle of the buttock, and this means that the solutions are completely different. Piriformis syndrome is extremely common in people over 50 who sit for long periods. Sitting shortens and tightens the piriformis continuously, and after years of prolonged sitting, the muscle develops chronic tightness and trigger points that keep the sciatic nerve under constant pressure. The reason this matters so much for today's video is that several of the most common sciatica mistakes I'm about to show you are particularly harmful for piriformis syndrome, and recognizing which type of sciatica you have will help you apply the right solutions. Now that you understand the 3 most common causes, let's get into the 5 mistakes that are keeping your sciatica from healing. Mistake number 1, resting too much. This is the first and in many ways the most damaging mistake, and it is completely understandable why people make it. When you are in pain, the instinct is to rest, to stop moving, to protect the area that hurts. But for sciatica, prolonged rest is one of the worst things you can do, and I want to explain exactly why. Your sciatic nerve is a living tissue. It requires blood flow and nutrients to heal. It requires movement to maintain its ability to glide freely through the surrounding tissues. When you stop moving and rest for days or weeks at a time, several damaging things happen simultaneously. The muscles that support your spine weaken rapidly. Research shows that muscle strength begins declining within just 48 hours of bed rest. Weak supporting muscles mean more load on the structures that are already causing your sciatica, the disc, the stenotic canal, or the piriformis. The sciatic nerve itself loses its ability to glide. In a healthy spine, the sciatic nerve slides freely through its surrounding tissues as you move your leg. But with prolonged inactivity, the tissues around the nerve tighten up. Adhesions form. The nerve loses its ability to move freely. And when you finally do start moving again, those adhesions create tension on the nerve that increases your pain. And finally, prolonged rest allows inflammation to accumulate rather than disperse. Movement is one of the most effective ways to pump inflammatory chemicals out of an area and bring in healing blood flow. Rest does the opposite. Cause 2, spinal stenosis. The second most common cause of sciatica after 50 is spinal stenosis. Your spine has channels and openings through which nerves travel. The spinal canal runs down the center of your vertebrae and contains your spinal cord. Smaller openings called foramina on the sides of each vertebra allow individual nerve roots to exit the spine. Spinal stenosis means that these spaces have become narrowed, and after 50, this narrowing happens as a result of the cumulative changes that have been building for decades. Disc height loss means less space between vertebrae. Facet joint arthritis means bone spurs can develop and encroach on the nerve channels. Ligaments that support the spine can thicken over time and further reduce the available space for nerves. The result is that nerves that once had plenty of room are now being compressed in a space that has become too small for them. Stenosis-related sciatica has a very characteristic pattern that distinguishes it from disc-related sciatica. People with stenosis typically find that their symptoms are worse when standing and walking and better when sitting or leaning forward. This is because leaning forward slightly opens the spinal canal and gives the compressed nerves a little more room. Standing and extending the spine does the opposite. It further narrows the canal. Understanding this pattern is critically important because it determines which positions and activities help versus hurt. And it means that some of the advice that helps disc-related sciatica can actually make stenosis-related sciatica worse. Keep this in mind as we go through the mistakes. Cause 3, piriformis syndrome. The third common cause of sciatica after 50 is piriformis syndrome, and this is one that is frequently missed or misdiagnosed. The piriformis is a small but powerful muscle located deep in your buttock. Its job is to rotate your hip outward. The sciatic nerve runs either directly through this muscle or immediately next to it. The anatomy varies slightly from person to person. When the piriformis becomes chronically tight or inflamed, it compresses the sciatic nerve and produces symptoms that are virtually identical to disc-related sciatica. Pain in the buttock, shooting pain down the leg, numbness and tingling, the whole picture. The key difference is that piriformis syndrome does not involve the spine at all. There is no disc herniation, there is no stenosis, the problem is entirely within the muscle of the buttock, and this means that the solutions are completely different. Piriformis syndrome is extremely common in people over 50 who sit for long periods. Sitting shortens and tightens the piriformis continuously, and after years of prolonged sitting, the muscle develops chronic tightness and trigger points that keep the sciatic nerve under constant pressure. The reason this matters so much for today's video is that several of the most common sciatica mistakes I'm about to show you are particularly harmful for piriformis syndrome, and recognizing which type of sciatica you have will help you apply the right solutions. Mistake number 3, sitting for too long. If there is one lifestyle factor that I see driving sciatica more than almost any other in my patients over 50, it is prolonged sitting. And in our modern world, most of us sit far more than our bodies were designed to handle. Here is what happens inside your spine and your sciatic nerve when you sit for extended periods. When you sit, the pressure inside your lumbar discs is actually higher than when you stand or lie down. Studies measuring intradiscal pressure show that sitting in a slouched or unsupported position produces some of the highest disc pressures of any position. This means that if you have a disc herniation sitting for hours, is continuously pressing that herniated material against your nerve root. Sitting also shortens and tightens your hip flexors, the muscles at the front of your hips that connect your spine to your legs. Tight hip flexors tilt your pelvis forward and increase the arch in your lower back. This increased arch compresses the facet joints and narrows the spaces through which nerves exit the spine. For someone with stenosis-related sciatica, prolonged sitting can trigger and perpetuate a constant cycle of nerve compression. And for piriformis syndrome, sitting is perhaps the worst thing you can do. Every hour of sitting is another hour of the piriformis being compressed and shortened directly on top of the sciatic nerve. What to do instead? The single most important change you can make if you have sciatica is to break up your sitting time. Set a timer for every 30 to 45 minutes. When it goes off, stand up. Take a short walk, do a few gentle movements, then sit back down. Even 30 seconds of standing and moving every 45 minutes makes a significant difference in the cumulative stress on your sciatic nerve throughout the day. When you do sit, make sure your lower back is supported. A small lumbar cushion or a rolled-up towel placed in the curve of your lower back while sitting maintains the natural curve of your spine and reduces disc pressure significantly. And avoid sitting on soft couches or soft car seats for extended periods. Soft surfaces allow your pelvis to tilt backward and your lower back to round, the worst possible position for disc-related sciatica. Sit on firm chairs with back support whenever possible. Mistake number 4, ignoring your sleep position. This is the mistake I mentioned at the beginning of the video, the one that surprises people the most, and the one that is silently making sciatica worse for a huge number of people every single night. Most people with sciatica never think about how their sleep position affects their nerve pain. They focus on what they do during the day, the exercises they do, the way they sit, the way they move, but they spend 6 to 8 hours every night in the same position without giving it any thought. And for sciatica sufferers, that position matters enormously. Sleeping on your stomach is particularly damaging for sciatica. As we covered in video 1, stomach sleeping puts your lower back into an exaggerated arch all night long. For disc-related sciatica, this arch compresses the back of the discs and pushes herniated material further toward the nerve root. For stenosis-related sciatica, it narrows the spinal canal further. For piriformis syndrome, it rotates the hip into a position that keeps the piriformis under tension all night. 8 hours of this position means 8 hours of your sciatic nerve being compressed or irritated, and then people wonder why their sciatica is so bad in the morning. Sleeping on your side with no pillow between your knees is the second most common sleep position mistake for sciatica sufferers. Without a pillow between the knees, the top leg falls forward and rotates the pelvis. This creates a twisting force on the lower spine that compresses the nerve all night. What to do instead? For disc-related sciatica, sleeping on your side with a pillow between your knees is the most protective position. The pillow keeps your pelvis level and prevents the rotational stress on your lower spine. Make sure the pillow is thick enough to keep your knees hip-width apart. For stenosis-related sciatica, sleeping in a slightly curled position, like the fetal position, is often the most comfortable because it keeps the spine in gentle flexion and opens the spinal canal slightly. For piriformis syndrome, sleeping on the non-painful side with a pillow between the knees prevents compression of the piriformis and reduces nerve irritation overnight. If you must sleep on your back, place a pillow under your knees. As we covered in video 1, this reduces the arch in your lower back and takes pressure off the lower spine and sciatic nerve roots. And please avoid stomach sleeping entirely if you have sciatica, at least until your symptoms are significantly improved. Mistake number 5, waiting too long to get properly evaluated. The fifth and final mistake is one that I see the consequences of regularly in my practice, and it is the most important one on this list. Many people with sciatica wait months or even years before getting a proper medical evaluation. They try home remedies, they watch videos like this one, they try different exercises, they take over-the-counter pain medication, and they keep hoping that the pain will just go away on its own, and sometimes it does. Many cases of disc-related sciatica do improve without medical intervention, given enough time and the right conservative management. But here is the problem. Without a proper evaluation, you do not know which type of sciatica you have. You do not know whether the conservative approaches you are trying are the right ones for your specific situation, and you do not know whether there is something more serious going on that requires medical attention. There are specific warning signs with sciatica that require urgent medical evaluation. If you have any of the following, please do not wait. Loss of bladder or bowel control. This is a medical emergency and requires immediate evaluation. Progressive weakness in your leg that is getting worse over days or weeks. Not just pain, actual weakness where your leg feels like it might give way. Numbness in the saddle area, the inner thighs and the area between your legs. This can indicate compression of the cauda equina, the bundle of nerves at the base of the spine, which requires urgent treatment. Sciatica that is rapidly getting worse despite rest and conservative measures. For everyone else without these urgent symptoms, a proper evaluation is still important because it identifies exactly which structures are involved. An MRI can show whether a disc herniation is present, how large it is, and exactly which nerve root it is affecting. It can show whether stenosis is present and how severe it is. It can guide the specific treatment approach that is most appropriate for your situation. Many people avoid seeing a doctor because they are afraid of being told they need surgery, but I want to reassure you, the vast majority of sciatica cases I see do not require surgery. The majority are managed effectively with physical therapy, targeted exercises, anti-inflammatory measures, and lifestyle modifications. Surgery is reserved for specific situations where conservative management has failed and there is significant nerve compromise. Getting evaluated early means getting on the right treatment path sooner. It means avoiding the trial and error of trying approaches that may not be right for your specific type of sciatica, and it means catching anything serious before it becomes a bigger problem. What to do right now? If you have been dealing with sciatica for more than 6 weeks without improvement, please make an appointment with your doctor. Ask specifically for a referral to an orthopedic specialist or a spine specialist who can evaluate you properly. You deserve to know exactly what is happening in your body, and you deserve a treatment plan that is based on your specific situation. Before I wrap up, I want to give you 3 solutions that are beneficial for all 3 types of sciatica, regardless of whether your cause is disc herniation, stenosis, or piriformis syndrome. Solution 1. Nerve flossing. Nerve flossing, also called neural mobilization, is a technique that gently moves the sciatic nerve through its surrounding tissues. It reduces adhesions, improves nerve mobility, and decreases sensitivity in the nerve. Here is a simple version you can do at home. Sit in a chair. Sit up straight. Extend your knee and raise your leg out in front of you as far as comfortable. Now flex your foot. Pull your toes up toward your shin. Hold for 2 seconds. Then point your toes downward and bend your knee back to the starting position. That is 1 repetition. Do 10 to 15 repetitions on the affected side, nice and slow. You may feel a gentle pulling sensation down the back of your leg. That is the nerve being gently mobilized. If you feel sharp electric shooting pain reduce your range of motion significantly, this should be a gentle sensation, not a painful one. Do this once or twice daily. Over the course of 2 to 4 weeks, most people notice a significant reduction in the sensitivity of their sciatic nerve with this technique. Solution 2. Targeted anti-inflammatory nutrition. Inflammation plays a central role in sciatica pain of all types. The nerve itself becomes inflamed when compressed. The surrounding tissues become inflamed, and this inflammation amplifies the pain signals dramatically. Reducing systemic inflammation through nutrition is one of the most underutilized tools for sciatica relief, and it costs nothing beyond changing what you eat. The most effective anti-inflammatory foods for nerve pain specifically are fatty fish, salmon, sardines, mackerel, which contain omega-3 fatty acids that directly reduce nerve inflammation. Turmeric with black pepper, which contains curcumin, one of the most potent natural anti-inflammatory compounds known. Ginger, which has similar anti-inflammatory properties. And dark leafy greens, which are rich in magnesium, a mineral that plays an important role in nerve function and muscle relaxation. On the other side, reducing processed foods, refined sugars and trans fats removes the dietary drivers of chronic inflammation that are keeping your sciatic nerve sensitized. Solution 3. Consistent daily walking. I mentioned walking when discussing mistake number 1, but I want to emphasize it again here because it truly is one of the most powerful treatments for sciatica available. Walking at a comfortable pace for 20 to 30 minutes daily does more for sciatica than most people realize. It maintains the gentle rhythmic motion of the spine and hips that keeps the sciatic nerve mobile. It pumps anti-inflammatory fluid through the spine. It maintains the muscle strength that protects the nerve. It improves circulation to the healing tissues, and it releases endorphins, your body's natural pain-reducing chemicals. If walking is currently too painful, start in a pool. Water walking or swimming reduces the load on your spine dramatically while still providing all of the movement benefits. As your symptoms improve, gradually transition back to regular walking. The key is every single day, not when you feel like it, every day. Let me bring everything together. The 3 most common causes of sciatica after 50 are disc herniation, spinal stenosis, and piriformis syndrome. Each has a different pattern of symptoms and responds to different treatments. Knowing your cause is the foundation of effective treatment. The 5 mistakes that are making your sciatica worse. Mistake 1. Resting too much. Keep moving gently and consistently every single day. Mistake 2. Doing the wrong stretches. Match your stretches to your cause. Forward bending makes disc-related sciatica worse. Extension makes stenosis worse. Know the difference. Mistake 3. Sitting for too long. Break up your sitting every 30 to 45 minutes. Support your lower back when you sit. Avoid soft surfaces. Mistake 4. Ignoring your sleep position. Stop stomach sleeping immediately. Use a pillow between your knees when sleeping on your side. Pillow under the knees when on your back. Mistake 5. Waiting too long to get evaluated. If you have been dealing with sciatica for more than 6 weeks, get a proper evaluation. You need to know exactly what you are dealing with. And the 3 solutions that help all types of sciatica: nerve flossing daily, anti-inflammatory nutrition, and consistent gentle walking every single day. Start with 1 change from this video today, just 1, and build from there. Because sciatica does not have to control your life, and now you have the knowledge to start changing it. If this video helped you understand your sciatica in a way that it has never been explained to you before, I would love to hear from you. Comment below and let me know where you are watching this from and which of these 5 mistakes you recognize in yourself. I read every single comment. And if you found this valuable, please hit the like button and subscribe to the channel so you never miss a new video. Every week I put out new content specifically designed to help Americans over 50 understand their back and take real control of their pain. See you in the next one.